General practitioners often need to consult with veterinary specialists who provide advanced knowledge and skills in their chosen specialty. These are veterinarians who have completed further training and testing beyond their veterinary degree to become board certified in their certain field. These are the doctors who see everyone's extra challenging cases, and they have advanced skills and imaging equipment to diagnose and manage many illnesses or surgical conditions.
A veterinary surgeon is someone who's completed additional training beyond veterinary school, usually an internship and a residency, so you're talking at least 4 more years after veterinary school to get this extra training to be able to do the more complicated and difficult surgical procedures that a veterinarian in general practice would usually not want to get involved in. So that's where we step in. Today we're doing a surgery that's very common for orthopedic surgeons in veterinary medicine, and that's repairing a dog's knee that has a torn ligament. Madison is our patient today, and she tore her anterior cruciate ligament. This is a very common problem for our veterinary patients. What we're going to do today is a surgery to correct the instability that's resulted from the torn ligament. For me, the greatest part of what I do is that I'm able to work with the dogs and cats. I enjoy being able to help them. They depend on us, they trust us, and I like to return that trust by helping them in any way I can. That's where I get my greatest pleasure is when my patients go home feeling better. The other part of my job that's very special to me is that I'm in a position to take my own dog, Annie, with me and have her be with me everywhere I go, including in the surgery room. She's asleep in the corner while I'm doing my procedures. She's at the patient's cage when they're waking up and she consoles them. She's my little adopted chocolate lab. She's about 11 years old now, and she's had a rough background, but I found her about 5 years ago, and ever since then she's been my best friend.
As a neurologist, the type of cases that we see are animals that have seizures or animals that are having trouble walking. So those are probably about 90% of what they come in through the door. So seizures, personality changes, weakness, knuckling or scuffing of the back limbs. And then as a neurologist, once we figure out what's wrong with that animal, whether it needs back surgery or brain surgery or whether it has meningitis or encephalitis, as a neurologist I can help take them into the treatment of those diseases, which is often a little beyond what most general practitioners want to get involved with. Being a neurologist, my favorite tool that's available to us at MassVet is the MRI. We've got a new 1.5 Tesla MR scanner that I think is pretty neat. The other diagnostic things that we have here are CT scan, ultrasound, video endoscopy, video otoscopy. The underwater treadmill, the physical therapy is a newer addition to veterinary medicine in the past 5 years and has been really the cherry on the sundae, or just the icing on the cake for helping animals with post-operative rehabilitation. So those are some pretty neat things that we offer here.
For our patients, we can really offer anything that they would offer in a human oncology facility. We have radiation therapy, we have chemotherapy, and we have surgeons as well. So pretty much it's very similar to how people are treated for cancer. There are several types of cancers that are very responsive to chemotherapy. Lymphoma tends to be one of the more common cancers we see, and that many of our patients will respond well and have a good quality of life.
There's some cancers where we know a lot about, just like in people. There's a lot of cancers that we have very good success with chemotherapy and or radiation, and as well as surgery. And then there's some where we don't know as much, and so we get into more the clinical trial type treatments where we do participate in some studies. If they're open and available, we're able to provide that for our patients as well. The dogs and cats seem to tolerate chemotherapy much better than we do. A lot of that may be related to the different dosing schemes that we use and our goals of our treatment. With radiation, we typically see similar side effects as we do in people with the skin, some changes on the skin in different areas, but that's a very localized treatment. We tend not to see more systemic effects with radiation, such as radiation sickness, nausea, vomiting, and things on that level.
A veterinary pathologist is a person who studies the diseases that occur in animals, the interactions between infectious diseases, degenerative diseases, and metabolic diseases, and how those affect not only animal health, but also how that can translate to affect and hopefully help human health. I chose to become a veterinary pathologist because when I went to vet school, I thought what was really most fascinating was understanding how the diseases worked and processed in each animal. And really the best way to understand that is to understand the pathology that underlies each disease. And for what we do, the best thing to do is to look at the histo slide, the histology slide, and say, this animal is affected with X, Y, or Z disease. And then go back to the practitioner and say, well, this is what we can do to hopefully treat that, and then kind of formulate a plan from there. The basic progression of a sample being submitted to a pathologist is that, say, a dog comes in with a mass on its leg. The clinician will then biopsy or excise that mass and submit it to a pathologist, whoever their referring pathologist is. So the pathologist then processes the tissue, which means that it gets fixed and it gets made into a slide. The pathologist then looks at it and renders a diagnosis. A report is then developed and sent to the clinician. The whole process can take 7 to 10 days, but from when the biopsy or mass is submitted to when the final report goes out. And then once the report goes out, it's a crosstalk between the clinician and the pathologist to talk more about the case if there are any confusing variables or anything else, additional information that may have developed over the last couple of days.
I grew up in the military. My father was a career Army officer. I started out on a different path as an infantry officer, actually. But I always wanted to be a veterinarian, so I didn't get into veterinary school the first time around, actually. I got into medical schools, but I didn't get into veterinary school. So I went off and was in an MD, PhD, but I finally got into veterinary school, so I switched over. Veterinarians are the Department of Defense representative for all the services, Army, Navy, Air Force, and Marines, and they're an integral part of the Army Medical Department, and their job is health of the soldier and his family, basically. Another big area is animal care. A lot of people, always say, why do you have veterinarians in the Army? We do take care of military and working animals. I get involved in that quite a bit in Afghanistan, taking care of working dogs. We take care of pets, mostly in terms of providing, health and welfare for the soldier, but also to prevent zoonotic disease transmission and whatnot. So we do that. They're involved with food inspection. Every bit of food that's consumed in the military, whether it's at a commissary, at a snack bar, at a military installation, is inspected by U.S. Army Veterinary Services. Every plant in the United States that provides food to the Army, Navy, Air Force, Marines is actually inspected by a veterinarian. And I did a little bit of that very early in my career. Research is a really big part of the Army Medical Department. In fact, the last commander of USAMRIID, which is United States Institute for Infectious Diseases at Fort Detrick, Maryland, which is the only other level 4 containment facility besides the one in CDC in Atlanta, is at Fort Detrick. And the last commander of that was a friend of mine who was a colonel in the Army Veterinary Service, not a medical officer, but a veterinary officer. There's several Army labs across the world, Kuala Lumpur and Nairobi. And Army veterinarians do a lot of research. There's a lot of specialties in the Army. We do a lot of infectious disease, tropical disease research. So that's another field. My job was primarily as a preventive medicine officer in special operations, special forces groups and civil affairs groups, both active duty and reserve. So I was a slightly different niche than the average Army veterinarian, but I did a little bit of all those things.